Mobola Savage in the building. No, she's not Tiwa Savage's sister, so do not get it twisted, right? You usually get that. Are you Tiwa's sister and all that?
Of course I do.
I just guess as much, like, I know. All right, so we're going to be talking about Botox and fillers right now. First of all, tell us, what is Botox and what is fillers? For those that don't know.
Thank you very much. That's a great question, and thanks for having me here once again.
Thank you.
Botox is just like a short form for botulinum toxin.
Okay.
So it's a solution that is actually injected to the skin,
okay,
or to the muscle actually, to actually cause like a temporal paralysis of that muscle. It's usually administered to people who have hyperactive muscles in their face. So you have, as you get to age, then you have wrinkles setting in around like your forehead area.
Yeah.
Then you have something called like a crow's feet when you smile, things like that. And this is where we administer Botox treatment. So it's supposed to just have that muscle relaxation.
Oh, okay. So what about fillers?
So fillers is completely different. Sometimes you will try to like mistake one for the other one, but then the fillers literally is just the way you hear car fillers typically. What it does is to actually add volume to an area of actually experiencing loss. So typical areas you find where you have loss of volume would be those areas around your mouth, the nasolabial fold. So that's the region in between your cheek and your nose, extending down to at least your upper lip area.
Okay, so basically, what I understand right now is it's more like, it's not surgical.
No.
It's more like an injection kind of thing.
Pretty much, it's like the way you would have your injection for anti-malaria, for instance. At the hospital, it's just that now it's designated for a different part of the body,
which is beauty. If you want to enhance your beauty. Okay, so are there any side effects for this?
Side effects, I know people always say these things about side effects. I know that most people are very keen about it. I want people to know that aesthetics is a branch of medicine, meaning that you have to be first a doctor before you can become an aesthetic doctor.
Okay. So you know what? We're going to talk more on that one. I didn't know that. I thought maybe it was something like I just go, have a training on it and that's it. So I've got to be a doctor first?
You have to be a doctor.
I still have a Dr. Mobola Savage in the building. Yes. And we're talking Botox and Derma Fillers, right? Now, you just told us what a Botox is and what a Derma Filler is, right? And you also told us that before you become an esthetician, you have to be a doctor.
An aesthetic doctor or aesthetic physician. You have to become a medical doctor first. You have to go through medical school.
Oh, nice. Okay, so is derma filler treatment, is it permanent?
So derma fillers are literally temporary.
Okay, so like for how long? Is it a year, 3 months, 2 months, like?
So depending on the choice of product of the derma filler, then that would actually determine how long it will last typically. So for instance, the commonest one would be the one with hyaluronic acid.
Yes, because our body actually produces it. So I did a bit of studying. So I hear that as you get older, right, and you get it's that draining off little by little. So people just want to fill it back up and stuff. Oh, okay.
So when you have loss of volume, like I mentioned, then you have creases just around your nasolabial folds. The fillers coming, and then the typical ones that is being used by most aesthetic doctors would be the one with hyaluronic acid. So typically for most patients, you would get really maximum benefits that would last at least between 3 to 6 months or 3 to 18 months depending. Now the people who would get more value for derma fillers would be those who probably don't have a very active lifestyle. So maybe people who are not very active or who don't do a lot of sport, talking and things like that.
So indirectly you're telling me don't even go there because I work out a lot, right? I do a lot of workout, like I'm extremely active. So, and I haven't seen any wrinkles or anything, but is it okay? You're a doctor now, and I say, okay, you know what? I just want to have this thing just for the fun of it, just to boost my ego, because there are lots of women out there that they're all right, but they want more. So is that okay, or they need to go see their doctor first and say, you know what, is this thing okay for me? I want to try it. Is it fine? Can I go with it? Basically.
Okay, great question. So for the fun of it, having a treatment, an aesthetic treatment for the fun of it, I won't necessarily advise that. But if having an aesthetic treatment for the purpose of enhancing your beautiful body already, then that's a go-go, literally. So most people actually make the mistake of the fact that, I have to turn 50 before I start to do all these treatments.
Okay.
Now bear at the back of your mind that Botox and derma fillers are anti-aging in nature. So literally what they do for you is they don't make you age exponentially once you start to get to a certain age. People would say, when you're 30, you just start to age exponentially, literally. But once you start to have this treatment, at least in your late 20s, you're able to age more linearly, and nobody can actually tell you.
But you know, this is Nigeria now. Like, how many people will go and meet their parents and say, I want to do Botox and derma fillers at age 20? They'll pack you out of here. Like, come on, get out of here. Are you serious?
You would be shocked. I mean, now it's a question of the fact that understanding that aesthetic treatments, while it's a doctor who administers such anti-aging treatments like Botox and derma fillers, or maybe of course like a nurse prescriber basically, it's still an elective, and then people want to feel beautiful. So there is that feeling good part of things basically. I mean, everyone wants to have a better version of themselves outside.
Okay, you know, because some people actually think Botox and derma fillers is only celebrities that actually do it. So it means if you just feel like you want to enhance and you can afford it, is that basically that's it?
Absolutely. It's just the way you would decide and say, you know what, I'm going to have just broccoli and things like that. I'm going to eat more healthy. That's the same way it is with having this beauty treatment and saying at this point here, I want to start using vitamin C serum or I want to start doing this thing. So it's all part of the beauty process.
All right. So you know what? We'll be right back and we're going to talk about myths and myths of Botox and fillers. I'm sure there are lots of myths out there. Okay, so we're still here. It is 35 minutes gone past the hour of 9 a.m. Beauty and the Tips is what you're listening to. This segment that talks about beauty, all things beauty. And I've got with me in the studio, Dr. Mobola Savage. All right, so yes, we're talking Botox and fillers, right? So I'm sure there are lots of myths about Botox and fillers. So what are the myths you've heard about?
Oh, yes. Thank you very much for that question again. So the myths I get with Botox and fillers. Number one is cultural. I mean, we're a multicultural region, literally. And then people say, oh my goodness, it's not good to just alter any part of your body. That's how God says it should be. That's a myth. Thinking that you're just supposed to allow yourself and allow age to catch up on you without enhancing anything is one very popular myth. Another one that I get often is the fact that they say, hey, but doctor, when I start the Botox or derma fillers and I don't have many again and I stop it, it just means that my whole face is going to scatter. It's going to be worse than it was before. I must correct that it's just a myth.
It's just
literally.
a myth.
So what happens is it's not because your face gets worse, it's because you're actually already used to that compliment of you looking younger, you looking refreshed. And then suddenly you don't have that going on anymore, and then you look into the mirror,
you feel
like,
older.
The volume, you just feel different. And then that difference is what motivates most people to actually come back. So it takes us to the third myth, being that, oh my goodness, once you start, you can never stop. You just get obsessed with it, and then the analogy,
and then you go broke.
It's just broke is very relative. Trust me. I mean, it's personalized for different individuals. Some people have like millions in their account. They say I'm broke. So
true.
Broke is relative for individual.
Beauty and the tips. All right. So you were saying?
Yeah. So I was saying that the third myth would be, of course, you're gonna get so obsessed. And then you don't want to stop anymore. It feels like crack. You're never going to want to stop. And I say to them, okay, you woke up one day, you turned 1 year old or 2 years old or 5 years old, and your mom says you have to take your bath twice a day or you have to take your bath 3 times a day. Who made that rule, literally? And then it becomes a way of life.
A way of life,
and then you don't have your bath for 1 week. you feel like very off. That's because
you feel irritated
exactly. That's the same way it is with aesthetics, literally. So it's just something you pick up. You look beautiful. You have your back daily because, of course, it makes you feel clean. It makes you feel acceptable socially. That's the same way with enhancements, typically. So it's the mindset. So we just renew our minds and then just tilt it to the right a bit and then go away with all the negativities about, oh, you're going to get obsessed. Would I say you're obsessed with having your bath? Would I say you're obsessed with brushing your teeth? These are actually cosmetic things we do every day without thinking about it.
Okay, so let me ask you one question. Have you done Botox and fillers?
Okay, so I can say for sure that the akara that we sell, I eat it.
Okay, because like they always say, charity begins at home. Okay, so I was just curious. I just wanted to know, so this is not, this is just, okay. All right, noted. Oh, okay. And also, so what I found out from you right now is that it is not surgical.
No, it is
because that's also a myth, because a lot of people actually think it is surgical. I used to think it was surgical until I did a research.
It isn't surgical at all. So another myth, of course, would be that somebody says, oh my goodness, when you get Botox, their face will just be hard like drawing board. They look like a ghost. And I'm like,
Beauty and the Tips is still on, and I've got a Dr. Savage in the building. All right, so Dr. Savage, since we're still talking about Botox and fillers, right, I just have this last question for you. Is Botox an alternative to facelift?
No, Botox is not an alternative to facelift. So Botox typically is intramuscular, meaning that it's supposed to cause like a temporary muscle paralysis to resolve wrinkles around the face, the forehead and other regions. But for a facelift, for you to require a facelift, it means that the face is falling. There's loss of volume, there's bone resorption and things like that, and that's why you need to have a surgery.
That's weird, a falling face.
These things are just very simple terms. For you to get a lift, it means that something is dropped. So you need to cut things off and then pull them in and snap them
back
properly in place.
Okay. So now I know the difference between a Botox and a facelift. Okay. So far we've discussed about the myths of fillers, derma fillers, and Botox. And we know what it is. We know that it is not a surgical procedure. Because that's what a lot of people actually, including myself, for a long time. You know when you're watching all these movies and all that, and like, so you just feel like,
call it a best kept secret for the elites.
Me, I must join that elite too. All right. So is there anything you want to also let us know? Is there any hack to be doing Botox or derma fillers? Is there any hack, anything like that?
So yes, definitely. One thing you want to do when you're getting an anti-aging treatment, especially Botox and derma fillers, is to ensure that you are getting it with a certified professional. So you need to be sure that they're certified to carry out this procedure, so you don't run into trouble. Now, with the myth of looking frozen, and I always say to my patients, if your friends can tell what you did exactly, like they can say, oh my goodness, Dr. Savage, you look different. Yeah, I can't place it, but you look different, you look beautiful, you look refreshed. But if they can say, oh, wow, you had a Botox treatment, then I did a bad job, come back for your money. So have somebody who can give you that very natural look, take you years back without somebody being able to notice exactly.
All right. And with that, we're ending the show right here. Thank you so much, Dr. Savage.
Thank you.
And hope you come back again. My name is Shine, and we're out.